Welcome to the Digital Clinic, the show where we dig into what actually works in digital marketing for healthcare and medtech, the strategies, tools, and thinking that move the needle when the rules are tighter, the stakes are higher, and that's the way we've always done it, is no longer a viable answer. Adam Turinas spent 2 decades in leadership roles with some of the world's largest advertising agencies before co-founding a clinical communications software company and ultimately selling it to Harris Healthcare. He then founded Health Launchpad in 2020. He wrote the book on account-based marketing in healthcare, literally, and runs a network of roughly 300 health tech marketers who are navigating this market in real time. His experience, running a clinical communications company, struggling with the same problems his clients now face, is what shapes how he approaches healthcare B2B marketing. In this episode, Adam explains what healthcare buyers actually need from the partners pursuing them, and what most marketing teams get wrong about earning the right to stay in the room. Here's our conversation. This podcast is sponsored by Wheelhouse Digital Marketing Group. Wheelhouse provides exceptional performance marketing for healthcare and medical device manufacturers. Every Wheelhouse client saw record performance in 2025, even after implementing HIPAA-compliant data solutions. Find out more at wheelhousedmg.com. Tell me about Health Launchpad. Tell me what you do and who you serve.
Right, so Health Launchpad is a healthcare B2B agency. So we work with enterprise software companies, services companies, venture-backed startups in digital health, device companies, anybody selling something significant to hospitals, health insurance companies. We help them with messaging and brand strategy and creative, and we have a superpower in account-based marketing. And the thing that I think sets us apart in the market is that the leadership team and actually the extended team all have hands-on experience of being basically in the marketing seat. So most of the people on the team have either been chief marketing officers or people like myself who actually run a health tech company. And so there's deep knowledge about the market and particularly how business-to-business healthcare buyers buy. We position ourselves as the pipeline growth partner for healthcare and with great emphasis on partner.
So tell me about the ABM superpower. What gives you a particular superpower in ABM for this market space?
I have a career in 3 parts. So my first part of my career was a couple of decades in the agency world and actually mostly doing business to consumer and not doing any healthcare. Myself and a friend who was a physician started a healthcare technology company kind of by accident. And so for about 7 years, we were selling to hospitals and did pretty well with it and eventually exited the company. We sold the company to a big roll-up company called Harris Healthcare. And then I thought, I want to go back to my first love, which is marketing. And when I set up Health Launchpad, I wanted to create the agency that I really needed when I was selling to healthcare. Because to be honest with you, I really didn't understand healthcare buyers initially. It took me a while to figure it out. And we really struggled. And I think, to be honest, I was using more kind of traditional B2B techniques that didn't really work. And so when I started Health Launchpad, I had become familiar with account-based marketing. And I thought, we're going all in on this because there's clearly a need. So this is going back about 7 years ago. And, you know, in enterprise technology and SaaS companies, ABM had been around for a bit longer, you know, because they're always the first to move, but not healthcare moves a bit slower. And so as I looked across the market and I talked to organizations, they'd heard about ABM, but didn't really know much about it. So I thought, you know what, I'm just going to make us the experts in it. And so we went all in on understanding it, perfecting it, tailoring it for healthcare. I got us on the map through a partnership with HIMSS, the big healthcare technology association.
Right.
And we did an educational series, about 6 webinars, where we talked about ABM in healthcare. And that started to actually get us business. I then doubled down on that. I wrote a book on it called Total Customer Growth. with a former CMO of a health tech company. And then had some great people join the company. One of my colleagues is a guy called Mark Erwick, who is a chief marketing officer at several health tech companies, who'd been practicing ABM for 10 years, which is pretty rare in this industry. And
Yeah.
the rest of our team then started to sort of really formulate not just the process, but putting together a sort of a technology offering that we could provide to clients so that they didn't need to go out and buy a product like Demandbase off the bat. They could buy that later. So we have essentially a sort of, we call it unbundled ABM, but essentially it's sort of set of tools that we provide as part of our service. And so the reason why it's so important in healthcare is that, the average sales cycle in healthcare is 13 plus months. If you're lucky, it's 9 months, but for most companies, it's much longer than 13 months. I mean, I had deals that went on as long as 4 years when I was running my health tech company.
Right.
There are, on average, more buyers involved in healthcare than there are in any other industries. So you're selling to a buyer group. And so we've perfected a process where the whole premise is start with who. So like, which accounts are you going after? So there are 6,000 hospitals organized into about 1,800 organizations. And then there are several hundred payer organizations. So it's not a huge number, but within that, you've got to segment and get really precise about who you're going after. So a large ABM campaign may be targeting 300 accounts, sort of $300 billion plus healthcare systems. And then within that, who's the buying group? And so you figure out who the personas are, the champion, and you map out the buyer journey and you build a plan around that. And then the measurement process for seeing how you're doing in terms of engaging buyers, figuring out who's in market, who's interested, who's actually coming to your website, who's responding to the advertising. And then as they move through their process, you're tracking with them, keeping them engaged. And when they're good and ready, you try and force them to sort of meet with you. This whole thing of just a pure lead generation for long sales cycles, things doesn't really work. Honestly, the buyers are like, we're doing our process. We've got our thing. We'll call you when we're good and ready. And so you can have your sales call us, bombard us, email us. We'll respond when we're good and ready. So just give us the information that we need to make our decision. You're not in control of this process. We are. And so that's essentially what we're helping our clients with.
So I'm curious about a couple of things. One is ABM has been around for a long time. What is uniquely different or difficult about ABM in healthcare?
Sales cycles are that much longer. The average tenure of a CMO in most industries is less than 2 years. In many cases, that's the length of a sales cycle. So, that's actually, so in enterprise SaaS, where maybe a sales cycle 6 months, if you've got 2 years to prove yourself, you've got 4 sales cycles to do it in. In healthcare, you may only have 1 or 2, 1.5 at best.
Right.
What that forces is that it's even more important for healthcare marketing executives to be able to demonstrate the value and the impact that they're having in growing the pipeline. And so, being able to connect marketing influence, which is effectively what you're doing, and tying that to revenue is, I think, even harder in healthcare than it is in most other industries. If you're selling to a bank, you'll be selling to a CIO who's a business person. You'll be selling to a banker who's a business person. You'll be selling to a CFO who's a business person. Well, if you're selling to a healthcare organization, you're selling to a CIO who's a business person and the CFO as well. But then you're selling to physicians and nurses. And in many cases, they may not have much in the way of commercial experience. And so they think differently and they want different things. You've got to create content that can sell a clear ROI to a business person, and then positions what you're doing in a way which is hyper relevant to a clinician. So it doesn't necessarily mean that it needs to be medically oriented or related to a condition, although quite often it has to be. But it needs to be very clear that you understand what it's like working as a physician. And then if you flip over and say, well, we're also selling to payers, it's like you've got to kind of get your head around the fact that actually payers, although they are called health plans and they're in the healthcare market and they are the sort of the middlemen in terms of everybody getting paid in healthcare. They're more like financial institutions than they are like healthcare
Right.
organizations, but they also have doctors on board. So they'll have chief medical officers. I'm surprised at how long it's taken this industry to adopt ABM, but we've seen it firsthand. So I would say we benchmark adoption of ABM. And when we first started benchmarking it, I don't know, back in 2022, the vast majority of the market, maybe more than 2/3, were interested but needed to be educated. Maybe 10% had actually adopted it. And then the gap, whatever it is, 20% were dabbling around with it. I would say now the vast majority have implemented ABM in some shape or fashion, whether that's having demand base and or working with an agency like us and doing it at baked into their go-to-market model, or doing B2B in an ABM way, sort of using ABM thinking in how they approach it.
As you're structuring an ABM campaign for a client with whom you're working, and you're mapping out the constituents you need to reach on the prospect side, give us a sense of the landscape, the universe of people you're trying to reach. As I listen to you describe this, I imagine that, as you said, it's much more nuanced and you're probably needing to reach many more constituencies, many more individuals than would be typical in a conventional B2B ABM context.
Absolutely. I'll give you an example. So take telehealth, for example. So the champion, so the main person you're selling to, and most likely the person who initiates this, could be one of 3 or 4 different roles. Could be the chief medical officer. So that could be the chief doctor, although frankly, what they do is more sort of kind of operational than medical. Could be chief nursing officer, who's in charge of often in charge of not just the nurses, but in charge of patient experience. And it also could be what's called a CMIO, chief medical informatics officer, who may well also be responsible for innovation and for the adoption, or it may be an operating person. So it could be one of those 4. Occasionally, it's also IT. It could be someone, a CIO as well, or somebody in there, VP of applications. Quite often, that could be one of those. So those are some of the roles. One of them is the champion. The other people will be actively involved in the process, and they'll probably make up the buying committee with somebody from finance and somebody from purchasing. So that's the kind of core team. You'll also often get a chief quality officer involved as well. And that's somebody, often they come from nursing, and that what they're responsible for is tracking the performance of the healthcare system against a set of measures that are set by the government through CMS. They'll be involved because they want to make sure that whatever they adopt is going to help the organization meet those measures and get paid for Medicare. That's just putting it in simplistic terms. You're going to get vetted extensively by security and compliance. And in addition to that, you're then going to get a user group. And so that will be both composed of the medical exec committee, which could be 10, 20 physicians who all get a say, and a nursing committee that may have 5, 6, 10 different people involved in it. And it's quite interesting. I was talking to somebody in our network who was the head of marketing of a telehealth company, and she shows this. They use demand base, so that she shows the journey over, I think it was a 12-month period of how people were showing up on their website and in their marketing funnel, and different individuals from the healthcare system. So initially it was 1 person, then it was 2 or 3, and then it was 4 or 5. As they actually got into the sales process, it went up to 10. And then right at the end, it was about 20 different people. So you can see these people coming. Before starting Health Launchpad, when I was running my software company, it was a clinical communications company, we'd often be in a meeting where we'd be presenting to 20 people. And you've got to be able to figure out beforehand, is this going to be more of a clinical team, in which case I brought along my partner who was a physician, or is this more an IT team? So do I need to bring along the CTO? You have to be able to adapt to that. So I think that's kind of that's what a typical buying process looked like. The other problem is because the buying process is so long, quite often a lot of these people change jobs or get fired or go work somebody else, or the organization merges. We had one deal which was amazing. We sold to an organization called Meridian Health, and we got very close, and they went with a different solution. And then we sold to this other organization called Hackensack, and we got very close, and then they decided that they were going to do it with some existing partners. So we lost both of those. Well, about 2 years after the first meeting we'd had with either of them, the two organizations merged, and we were brought in by the chief innovation officer of the newly merged organization, and then went through an 18-month process to went back to the start and eventually won the deal. And the irony was that we won the deal, got it signed, and then a new person came into a role in the sort of nursing and patient experience thing. And she said, well, these guys got really lucky that they signed the deal last week, because if I'd come in, I would have actually killed the deal, because I don't want to hire them. I want to use Epic to do this. And this is fairly difficult. This is what our clients and the salespeople live with, daily. It's tough. It's very, very difficult.
Yeah.
People don't really understand the importance of relationships and trust. And I saw that, firsthand, because, coming up through the sort of traditional agency world, like particularly working for agencies like Ogilvy and Mather, you learn the importance of long-term relationships. They had a relationship with IBM that lasted 30 years. One of the things that I actually did between leaving the big agency world and actually starting a tech company was I worked for this organization that would actually assess the performance of agencies. So we do it for companies like Novartis and McDonald's. I always thought it was just shocking how experienced agency people didn't get that. Building Health Launchpad, we go in, we try to focus on hiring people with a lot of experience who understand that. And so it means that our people are pretty expensive. But as a result of it, we have grown-up relationships with our clients where we are, we earn the right to be considered a strategic partner. Don't always get it right, but I would say I don't think we've ever lost a relationship because we screwed up the relationship. We may have not been able to deliver the results they were hoping to get, but it wouldn't be for lack of trying and for lack of trust. I hope not. I may be wrong on that, but I think in most of the cases, I think that's the case.
Obviously, you focus on ABM, and we've talked about that a lot, but you've also talked about what you termed ABX, the experience after you win the sale, which really, I think, speaks to, what you were describing here.
We were on site recently with one of our oldest clients we've worked with for 5 years, and it was just great to have the full team. I think there were about 8 of us in the room, and then there were, over the course of the day, there were probably about a dozen clients that were in there too. And so people who've been working together remotely for a couple of years now or longer, finally got to meet each other. And the only thing I could think of is I wish I'd done that sooner. To be honest, I don't think anybody was ready for it until recently. But it makes such a difference. And so we try very hard in the relationships that we have with the agency clients, rather, to earn the right to be considered a partner, which means more than just delivering leads. It means, hey, we think you need to improve. There's some things that need to get fixed on your website, or, from a product standpoint, this seems to work really well. Have you thought about this?
So you said you're looking to deliver more than just leads. We are very much the same. In fact, even in the way that we structure our digital advertising, we integrate with our clients' CRMs, other platforms, so that we're optimizing for the moment a lead actually becomes a customer or a patient. And we can do that because we have a BAA with our clients and a data warehouse that's HIPAA compliant and that sort of thing. Are you creating the same sorts of measurement frameworks so that there is not immediate, but there is an intermediate signal that says, these leads actually developed into clients, and those clients have an estimated lifetime value of X. And so that tells us something about the way that we should continue to go to market.
We do. I would say that the measurement drops off at the point it gets handed to sales.
Sure.
Because for our clients, they may have been engaging this prospect for 7 or 8 months. They then hand it off to sales, and it's like, okay, now it's the next 7 or 8 months of actually closing the deal. But one of the things that we've helped some clients develop are deal stories. So it tends to go back from the point at which they become a client, but more of our more long-standing clients.
Yeah.
We help them map out the deal story of how healthcare X, system X became a client. And it's really kind of interesting when you see all the different touch points. So that sales says, oh, yeah, okay, I get, it wasn't just the fact that I met them at HIMSS. It was they'd had 6 months of actually downloading content and seeing all this, seeing the advertising, having a call with an SDR before they were actually ready to meet with them at HIMSS.
Right.
So they will starting to give marketing credit. But then what we're actually seeing is with some of the deals is that, now actually we're in year 2 and they were initially a $500,000 deal and it's now expanded to $2 million. I run a network of health tech marketers with about 250 people in the network. It's actually a bit more. It's closer to 300 now. We meet once a month. Yeah, usually about 30, 40 people show up to the 2 meetings that we have. And we've got a calendar of topics and we talk about the topic. And sometimes we'll bring in some learning or an expert. Other times we'll have a general discussion. But one of the things which has been, the top topic, not surprisingly, for the last 2 years is AI. And we've been benchmarking adoption. And what we're seeing is it's moving pretty quickly from we need to be doing something about it. We're all using it, but not in a strategic way, to more and more of the organizations now actually having like a specific, a very clear strategy in how they're using AI. Some of them are buying it in, so adopting content platforms or workflow platforms like Jasper. And others are doing things like we're doing, which is building their own workflows and creating their own vector stores and so building their own technology. In fact, there's a guy I had on my podcast called Nick Panay, who was until recently the chief marketing officer of Inovalon. And it's incredible what they've done. I mean, they have created an agentic workflow for paid search. I mean, it's just remarkable what they've done. They've also developed a system for what they call agentic opportunity scoring, so that it can look at history of the best customers and use that to actually identify early on in the pipeline which of the deals that are in the pipeline are likely look like the most profitable customers. That's where I'm seeing the greatest differentiation. And that sort of use of AI ranges, as I say, from a very few companies that are building their own workflow systems to the other end of the spectrum, just using it in a tactical way. But I mean, that's to me is the most interesting thing that's going on.
How the perspectives, the interest, the criteria of buying committees change. So, for example, in our instance, we're focused on performance marketing for privacy first industries, for healthcare and medtech. And for us, a catalyzing event was new HHS guidance around third-party tracking and the definition of PHI at the end of 2022. Have you seen similar things that have had dramatic impact on the frames of reference of the buying committees, the constituents on the healthcare side?
So let me go through the waves. First of all, there was COVID, where it's like everything shut down. It bifurcated. So it's like everything was either completely shut down or like if it was a telehealth platform, buying like crazy. Then there was the coming out of the immediate post-COVID, where it changed again. So organizations try to get back to the new normal. And that meant, like, for example, for telehealth companies, suddenly actually getting used to the fact that actually they weren't, that behavior that they'd seen for the last 18 months was not the norm. It was actually what it was like beforehand, where sales cycles were a year long. The two things that have happened in the last couple of years has been the change in administration and taking a different approach has created a lot of uncertainty, and particularly with the bill OBBA going through, and the sort of the cuts to Medicaid has had a big disruptive effect, and it's meant it's slowed things down an awful lot. However, there's also the other thing that's going on is AI, and so healthcare systems are adopting AI like crazy because they see it as solving some really important problems that they've got. First of all, efficiency and cost reduction, particularly in improving back office operations. And then things like improving patient satisfaction and workflow, like particularly how patients come into a healthcare system and get sort of the interface they have, what's called the digital front door. And then the third area is in physician satisfaction, because one of the biggest problems in healthcare that a lot of people don't realize about is physician burnout is a huge issue. And so things like ambient AI, like we use Fireflies or Otter AI to record calls, like it's sort of part of what we do. So there are HIPAA compliant tools like Abridge and DeepScribe that do the same thing and actually a hugely positive impact. And that's before we even get into the impact that AI is having on specialties like radiology. And so we're living in this right now, we're living in, I think, a bifurcated market. And so if you're selling AI, it's about how fast can you move. The other half of the market is in a market that was going slow beforehand, that might be going even slower. And so it's very disruptive. I'll tell you the thing one of the really unpleasant consequences is a huge amount of turnover in leadership in marketing.
Yeah.
So I mentioned I've got this community. It seemed to be worse last year, where it didn't. Last year, it felt like there wasn't a week that went by where I didn't hear a friend of mine in the community losing their job. It's still going on. I don't think it's quite as bad as it was, but maybe we just got used to it. But it's a tough time to be a healthcare technology marketer.
You see a lot of what's happening among healthcare marketers, and you see what's happening on the health tech side as well. What advice would you give to healthcare marketers? What are they perhaps not seeing that they should see? What are they not paying attention to that would be most valuable?
3 or 4 years ago, I would say you've got to get your head around ABM, because the old sort of traditional B2B model of just sort of lead gen just didn't work anymore. And so anybody who hasn't shifted towards ABM, really needs to. But there are very few companies. The other thing was, I would have said, a year ago, I would have said, you've got to stop using AI tactically and just sort of for personal use, and think about how to use it systemically and strategically. I think that most of them are moving in that direction. So I think that there's a getting it. I think the challenge that sort of, when we ask the community, like, what's the top issue, the recurring theme, and I don't think this has changed in the 6 years I've been doing this, is the demonstrating the value of marketing to leadership is really hard. And it's the single biggest challenge that's common across the community. I've found that there are some marketers who've cracked the code on it. And I'll tell you the proof of the sort of the level of interest there is in it is that I have this week, like you, I have a weekly podcast, and we cover a range of different topics. And I did one recently called Connecting Marketing to Revenue. It's been had a couple of really great guests on it, very smart marketers who've cracked the code on it. It has been our most listened to episode, and it just continue. I could see people continuing to listen to that. I think that, so that's one thing. The other thing is you can gain competitive advantage right now by realizing that inbound marketing, the traditional inbound marketing model, is blown up. So we're in a case in point. So when we started the company, we got, for the first 4 or 5 years, 50% of our business came in through referrals, 50% of our business came in through SEO and SEO plus LinkedIn. I'm a bit of a maniac on LinkedIn. And what we found is that, last 18 months until the beginning of this year, we were seeing like a bit of a decline in that inbound, like a lot of people, because buyers are shifting over to the LLMs. We went all in on optimizing our content and our website for the LLMs. We bifurcated our strategy. So we have a thought leadership program built around the podcast. And then we have content which is written to be enjoyed by humans, but frankly, it's written so that the LLMs will cite it. And we're seeing articles getting cited in 2 weeks. Inbound now, I think, accounts for about maybe 70% of our demand. And that's mostly coming from the LLMs, but increasingly coming from the podcast. And that's a remarkable thing. And that's something which I think if you're a marketer out there and you're trying to gain a sort of a competitive advantage over the next 2 years, go all in on your podcast, but really go in. And if you've got to pick between two, go all in on optimizing for the LLMs, because you can get that to pay off quickly if you're smart about it.
The thing Adam said that I keep coming back to is this. In healthcare, the buyer is always in control of the timeline. Your job's not to speed that up. Your job is to be the most credible, most present option when they're finally ready to move. That takes content and nurture sequences that hold up over 13 months or longer, and a measurement framework that gives leadership something real to look at long before the deal closes. You'll find Adam Turinas on LinkedIn and at healthlaunchpad.com. I'm Aaron Burnett. See you next time.